What's the difference between acute and chronic liver enzyme levels? Imagine your liver as a busy factory that keeps your body running smoothly. When it gets hurt or stressed, the factory releases signals called liver enzymes into your bloodstream. These signals help doctors figure out what's going on inside. But not all signals mean the same thing. Some indicate a sudden problem, while others suggest ongoing issues. Understanding the difference between acute and chronic liver enzyme levels is key to interpreting your liver test results accurately. In cases of acute liver injury, like when you catch a sudden viral infection or accidentally take too much medication, liver enzymes spike dramatically. Enzymes like alanine aminotransferase and aspartate aminotransferase can skyrocket to thousands of units per liter. For example, in severe toxic injury from medications like acetaminophen, ALT levels can go over 10,000 units per liter. This sharp rise shows that liver cells are dying quickly, releasing their contents into the blood. Once the injury is treated or resolves, these enzyme levels tend to fall back to normal or near normal levels pretty fast. Usually in acute injury, ALT is higher than AST, unless alcohol is involved, where AST might be higher and the ratio exceeds 2. On the other hand, chronic liver conditions such as hepatitis B or C, fatty liver disease, or cirrhosis tend to cause more modest changes in enzyme levels. These levels might be only slightly above normal or fluctuate over time. Sometimes, they can even stay within normal limits despite ongoing damage. This is because chronic injury involves programmed cell death called apoptosis, which leaks fewer enzymes into the blood compared to sudden cell death or necrosis. In these long-term conditions, AST often becomes higher than ALT, especially in alcohol-related liver disease or cirrhosis. The enzyme levels in chronic disease tend to stay elevated intermittently or persist over months or years, rather than spiking suddenly. To sum it up, when liver enzymes are very high, it usually points to an acute problem that needs quick attention. These spikes are often more than 5 times the upper normal limit and happen suddenly. When enzyme levels are only mildly elevated or fluctuate, it suggests a chronic process that develops over time, like ongoing inflammation or scarring. The pattern of enzyme levels also differs. In acute injury, ALT is typically higher than AST, while in chronic disease, AST may be equal to or higher than ALT. Understanding these patterns helps doctors decide what's happening inside your liver. Persistent enzyme elevations in chronic disease can signal ongoing inflammation and scarring, which might increase your risk for serious issues like cirrhosis or liver cancer. Acute spikes, while often temporary, can sometimes lead to severe liver failure if not treated promptly. That's why it's important to interpret liver enzyme results alongside other tests, imaging, and your medical history. If your liver enzymes are abnormal, always consult a healthcare professional for a complete evaluation. Remember, each person's situation is unique, and only a doctor can provide the personalized guidance you need.